The kidneys, yes. Vitamin A deficiency, all of these areas that are supposed to be columnar in nature will become squamous if you're deficient and become keratinized. And we'll see as to what this looks like. It's amazing. Oh, and also, vitamin A deficiency in the eye in the form of retinal will turn into, will manifest itself as night blindness. But then, if it's a vitamin A deficiency in the form of retinoic acid, it can also, because you have lacrimal glands, right? Lacrimal glands. And those are columnar. If you can't produce the tears, you can't protect the eyes either. So let's take a look at all this. Interesting enough, PML, promyelocytic leukemia. 15, 17. All I'm trying to say here is, you're not being tested on this. I just want you to understand vitamin A. It's part of differentiation. Promyelocytic anemia. You stop the differentiation. Okay? You stop the differentiation. Interesting. If you give all-trans retinoic acid, it actually stimulates the differentiation, especially that of neutrophil, acutely. Because, I mean, what do you think about when you think of leukemias? You're talking about a patient who is what? Immunocompromised? Neutropenia, possibly? So if you can help this patient along, you understand what I'm saying? If you can help this patient along by differentiating into a neutrophil, well, at least for a little bit, it is rather short-lived, but at least for a little bit, you're saving the patient, and it's worth it, people. It's worth it. All right, so this should all make sense. You'll not be tested on this, but as far as vitamin A, there are theories out there that it might be the 14-hydroxyretinol form that stimulates the humoral arm. What's humoral? Yeah, B cells, right? Diarrhea. Why diarrhea? Why would vitamin A protect you from diarrhea? What's in the intestine? Columnar cells. Yeah, so it will maintain the integrity of the intestine. Protects you from diarrhea. Measles. Measles is an airborne pathogen. Airborne pathogen. If you're vitamin A deficient, are you going to be resistant to this particular virus? No, you're not. It's squamous. All right, undergoes keratinization. You don't have the mucus to protect you from the measles. All right, so now let's take a look at this in children. If your liver is being affected, anything that affects the liver, retinol binding proteins, you don't have the RBPs. If you don't have the RBP, in essence, you can't circulate the retinol, or retinoic acid. Retinol. You can't transport the retinol. If you can't transport the retinol, essentially, aren't you deficient? Yes. Adults, all the fat malabsorption syndromes that we spoke of. All right. Once again, here, I emphasize, what type of metaplasia are we speaking of? If you have vitamin A deficiency. Squamous metaplasia. Okay, columnar 2, squamous metaplasia, keratinization. Then, collectively, think about this. Spoke about this earlier. It's a story, okay? It's a story. You have dryness. If you have dryness, next. That's cirrhosis. Next, you'll go on to actual BTO spots, and we'll see that. And then you'll go into keratomalacia together, collectively known as xerophthalmia. And then bronchopneumonia. Why? Because you can't protect yourself. Urinary tract. You'll see, because of the keratinization, you can have keratin stones. Skin. We'll see pictures of this. What do you have in skin? Sweat glands, apocrine glands. All those things undergo squamous metaplasia. So we'll talk about follicular and papillary dermatosis, or you'll see pictures of it. Impaired immunity, yes. Interesting enough, in third world countries where they might be deficient in vitamin A, okay, it increases their survival rate, just because you increase their immunity. Okay, 20 to 30% reduction in mortality rates after giving vitamin A. This is just a cute little picture. I just had Levin's. I actually found something. You can find everything. Levin's cyst. Easier way for you to remember Levin's cyst retinal. Okay, that's all I have there. It's Levin's cyst. Okay, so Henry Vaughan said, they were all gone into the world of light, and I alone sit lingering here. Their very memories fair and bright, and my sad thoughts doth clear. On your far left is normal vision. At night, normal vision. You're driving in your car, there is an oncoming car, that's what you would see. In the middle, as the car passes you by, these are your headlights, and this is what you can see. The last picture, vitamin A deficiency, night blindness. The car is passed, and that's as far as you can see. You think deer come up rather quickly? Imagine on this patient. My goodness. Best of luck with you. All right, so here's a story of the eye. Not so much the night blindness part, but the epithelium. Lacrimal glands, the tears. If you don't have the tears, if you don't have the tears, you have xerosis or dryness. Results in BTO spots. Just excessive dryness. Next, because of the dryness, it can't protect yourself anymore, so you end up with keratomalacia. Kerato. Any idea? What part of the eye? Cornea. Malacia, degradation. All because of dryness, all because of vitamin A deficiency in the form of retinoic acid. And just like anything else, when you have a myocardial infarction, what are you going to end up with? A scar. Exactly. So you're going to have a corneal scar. Collectively, right down the middle, they're known as xerophthalmia. Summarization, schematically. All right. So what kind of things are we going to see in the kidney? Don't memorize this. You're going to see keratin stones. What are you going to see on the eye? Interesting enough, in nature, there's something known as a moonbow. Sad if you're vitamin deficient and you have night blindness and you can't see that moonbow. Simple things that we take for granted. Simple things that are out there that we don't even appreciate because we don't even know how to open our eyes. All right. So you have maculopapular scaling rash. Why the rash? Once again, vitamin A deficiency. It's squamous metaplasia. Ascites. Secondary to liver dysfunction, hypoalbuminemia. Okay. If you have liver dysfunction, you can't transport you don't produce the RBP. Right? Possibly hepatitis or something like that. Alcoholism. Okay. Beefy red tongue. You'll see this quite a bit with tongues. All right. You see glossitis. So make sure that you take a proper history of the patient. All right. There are a bunch of vitamins and a bunch of conditions in which you would see glossitis. In this particular case, it's beefy red tongue. All right. Bilateral angular stomatitis, and that basically means cracks in the middle of your, on the sides of your lips. Follicular hyperkeratosis. This isn't you becoming nervous because of your first date and you have butterflies in your stomach and you have goosebumps. This is goose flesh. This is permanent. All right. No matter how much you try to rub this stuff off, it's not going to go anywhere because it's vitamin A deficient. Your sebaceous and apocrine glands are all dried up. Okay. Follicular hyperkeratosis. And if you were to take a look at the epidermis, microscopically, normal is in the middle. You can see patchy keratosis. Right there. Number 2, you'll see hyperplastic epidermis. Epidermis itself is hyperplastic in nature. And then here, the granular layer is extremely thick. Okay. So I wanted you to see what it looks like grossly, microscopically. Vitamin A toxicity. All right. Where is vitamin A mostly stored? In the liver. Okay. Those individuals who are fanatics about bear hunting in Alaska, whatnot, and you feed on liver might suffer from vitamin A toxicity. Don't get this mixed up with brain tumor. Okay. I mean, not that you're going to come across this frequently, but just in case, so that you have various differentials in your head. Because a patient will present with anorexia, nausea, and as you know, contraindicated in pregnant women. It's a teratogen, toxic to the baby, bad. Beta-carotene, however, is rather non-toxic. Garetavir, this is definitely tested. I'm joking. Garetavir was an individual who founded Antarctica and got extremely hungry, went crazy on polar bears, and possibly suffered from vitamin A toxicity. We'll stop there for the hour. I'll see you back in 5.